Hi everyone, thank you so much for joining us today. We have a wonderful panel discussion coming up. And before that, my name is Kartika and I am from Lead Square's marketing team, and I will be your host for the day. And today, like you might have already seen, we will be discussing a very exciting topic, that is Healthcare Marketing 101, strategies for success. Let me quickly welcome our wonderful panel of speakers today. We have Mr. Saravanan Raman, who is the Director of Marketing and Business Development at Noble Hospitals. Thank you so much for joining us, Mr. Saravanan.
Pleasure
Uh,
to be here.
Thank you, sir. We also have Mr. Abhishek Thomas, who is the Chief Manager of Marketing at Manipal Hospitals. Thank you for joining us, Mr. Abhishek.
Thank
Pleasure to
you.
have you here. We also have Ms. Shibani Roy. Shibani is the Associate Director of Marketing here at Lead Square. Thank you so much for joining us, Shibani. It really feels great to have you back on one of our sessions again. And I'm really looking forward to learning from all of you today. I'm sure our experts are, waiting to share their feedback as well. But before that, I have a few pointers to the audience. So if you look towards the right side corner of your screen, you'll see a few options. First one being polls. So that is where we'll publish a couple of polls during our session. Please do respond to them. We would love to hear from you. The next one is the questions tab. So this will be your go-to for any doubts you might or might not get during the actual session. So our experts will take them up as and when they come. And we also have the chat tab where we can network with each other. And for better viewer experience, please do use the full screen tab. With that, I think I am going to hand the session over to our wonderful panel of speakers. Shibani, please take it ahead. Thank you.
Thank you so much, Kartika. Hey, hi everyone. So as Kartika mentioned, I have two stalwarts, so to say, in the healthcare sector, Mr. Sarvanan and Abhishek. So glad to have you here on the panel. So let's get started. So for me, I feel like healthcare has also changed with the times, and like I think every other sector, responsiveness and speed are two things that come into play for me. And I know several people, we want things to happen fast, we want things to be at our fingertips, right? And the more responsive a business operation, any organization is, the happier we are. So with that, let me probably start with the discussion, and that my first question actually goes to Mr. Sarvanan. So Mr. Sarvanan, what are your thoughts on the modern patient today? What are their expectations? What do they want? What sort of change have you seen, let's say, in the last 10 years?
Thanks, Shubhani. When we talk about today's patient, I think there's been a paradigm shift in the way the patient looks at the care that he or she gets. The patients are more discerning, patients are more demanding. Uh, Apart from the clinical aspects, which is considered more of a hygiene factor, I think the experience that the patient gets when they walk into a clinic or a hospital is of paramount importance. A lot of emphasis is laid on how they are greeted, how they are treated, the more in terms of the non-clinical aspects. And I think most of the patients, before they come in to consult any doctor or any specialist, any clinic or a hospital, uh, many of them do their own Google research and things like that and try to have some amount of information about their symptoms or the problems. To that extent, I think they come with a set of ideas which they want it to be either confirmed, validated, or negated. Based on which, I mean, there might be situations where they argue with the doctor, there might be a situation they accept, but then the situation is such that there is a constant exchange of ideas between the consultant and the patient. Having said that, it is also difficult for the consultant to spend quality time with the patient, looking at the influx of patient and the footfalls that many organizations have. So there is always a challenge between the time that the consultant allots to the patient to the time the quality time that the patient gets, because and there are situations where some of the questions are answered, some questions still remain in the patient. But by and large, in a nutshell, if I have to say, the non-clinical aspects and the experience that the patient gets take more importance than the actual clinical aspects which are definitely a hygiene factor today.
Okay, okay. So, Abhishek, my question to you in that regard would be, when it comes to expectations, how has technology played a role? Do you see any examples or any areas where, we could do without technology, we could do without tech a few years ago, but today that may not be the case?
Yeah, see, the technology advancement in the overall industry has, as you rightly mentioned, it has actually changed the expectation of the patient and how they want to be consulted, how they wanted to be treated. Because as Mr. Sharan mentioned, before they come to the hospital, walk into the hospital, it is like buying a mobile phone or a car to the patient. They have the entire background. They have checked the doctor's profile. They know where all they have studied, what is the kind of expertise they have, what is the kind of experience they have, and in the current situation of their health, what are the kind of treatment offered in the industry, and what are the kind of technology which is available in the market for their treatment. These patients are quite well aware about it, especially in tier one cities like Bangalore, Bombay, Pune, and all those, where the people are very much accessible to the technology. They are very competent when it comes to their knowledge about the healthcare. And gone are the those days that the patient comes and just believes whatever the doctor says, or whatever they get information from the doctor, and they go and just go follow these things like that. But they completely have a knowledge. So for this, in this kind of scenario, what I understand is in healthcare, as a service provider, we have to be advanced in all kind of technology in terms of the initial, right from how the patient is taking appointments to the hospital, and how once the appointment book, how the flow to the hospital before coming to the hospital, what kind of information they get in terms of the assurance of their time management and things like that. And also, especially if it is a revisit of the patient, what we understand when we have this discussion with multiple doctors and things like that, the patient has an expectation that the moment they go to a doctor's chamber, doctor has to remember the entire thing what they have told last time, what kind of investigations were done, what kind of discussions happened, what kind of uh, pre-examinations all happen, because they get this very very limited time, right? 10 to 15 times is the maximum time any doctor can spend with any patient. So this 15 minutes is very important for the patient, and this is important for the doctor also. So the challenge what we see is especially when we are dealing with a large volume of the patient in the industry. Each doctor sees 40 to 50 patients in a day, and this is a complete loop, right? Every day this keeps happening, and this patient would have met the doctor maybe 3 months back, and the patient comes to the room and they expect the patient doctor to remember the entire things, and which is absolutely not possible. It is practically not possible. For how the technology is helping us in this is, especially with these. The electronic medical record system, which is greatly advancing in the industry. The software like TrackCare, or software like Care 21, and many software which is available in the market. So these kind of platforms helps the doctors. So there is a time between one patient goes out of the room and the other patient comes inside the cabin. So during this period of time, if doctor clicks their MRN number or whatever the medical record number, doctor can see in the screen an overview of the entire patient, that what is the kind of discussion happened, what is the kind of investigation, what is the graph of their the basic vitals and the sugars and things like that. At a glance, they can see. So these kind of technology, there are many tools like this which has been developed and customized based on each hospital's requirement, each doctor's requirement, and things like that. These kind of advancement is actually helping us to catch up the momentum in the market. And also, as I mentioned, these the kind of experience and the qualification and kind of expertise and experience they have it in various diseases and various specialty. This plays a major importance. So for that, what we need to keep it in our mind is the profiles of the doctors, profiles and the ability of the or capability of the doctor and the hospital has to be clearly defined in our website, in the platform where we are projecting our consultant and the hospital and service and things like that. What kind of technology we are using, what kind of equipments we have, where all the doctors has the specialty, what kind of experience, how many surgeries he has done in these kind of and what is a patient testimonial, how can they connect with this patient, the same kind of patient he has operated and things like that. These kind of lot of things are there which can actually improve the experience of the patient, increase the confidence of the patient when they are walking into the doctor. Also giving an assurance to the doctor that they are actually going by the fact and the data instead of just going by the random memory of what they have and things like that. So this kind of technological advancement is there in the system, and also the patient's expectation is also absolutely on the track that they have this expectation. I think as an industry, we need to invest more in this kind of technology. We need to spend our time and energy. These things are just not ready made, because if when I talk about these kind of software like the software which is created by Tracker and all, these are all very random softwares, which is basically developed for American countries and Europeans and things like that, which is not actually compatible with Indian market. Because if you look at the US and UK and all that, the volumes are very less. They see 2-3 patients in a day and things like that. So they have a lot of time to analyze and things. But if we are not in that kind of scenario. So we need to customize this kind of software specifically for our kind of target group. So there is, as an organization, as an industry, as a expert, we have to consider this as a priority. We need to spend time, money, and invest in training doctors and the non-medical staff on these kind of experts. This is my thought about it.
Sure, thank you. I see questions are already coming in, but before that, I will just jump on to the next question, and then we will take up your question, Dipali. So, I think both of you agreed on the fact that the patient also does the research now before going to the hospital, looking up the doctor. So, what I would take away from that is that earlier the doctor knew everything about the patient. Now the patient knows everything about the doctor. So, keeping that in mind, Mr. Sarvanan, what are some of the other trends that you are seeing in the healthcare space, good or bad? But could you please throw some light on that?
In today's scenario, you see that with the explosion of information being available on mobile devices, the access to information, the access to health records, I think as has its own pros and cons. Because when there is a patient to doctor interaction, uh, I mean, a lot of things are already available both with the patient as well as with the doctor. Abhishek pointed out that technology plays a huge role in the today's environment. I would put it across saying that technology is not only a business enabler, but is also a care enabler, to the extent that the patient is able to understand the kind of treatment or the options or the plethora of choices that the consultant or the doctor might give, and based on data. Everything today is evidence-based medicine. The consultant also has the data in front of him in terms of health records to kind of explain to the patient. That is on one part. That is as far as the hospital information is concerned. But if you look at the availability of information in technological platforms, for example, making available the test reports of the patient on, say, patient apps, on patient portals, then access to your health data from a remote location. I mean, having the information on your mobile, because we are in a mobile world. So all that enables the patient-doctor interaction and helps in the overall treatment paradigm. That's something that I think we should all keep in mind. And with more and more integration of the technological tools, the treatment options are going to get better and better, and the data points will be clearly defined in terms of driving the treatment options based on evidence.
Sure. Any points that you'd like to add, Abhishek, when it comes to personalized care? So some of what Mrs. Sarvanan talked about did so say mention personalized care back and forth on the mobile. Anything that you'd like to add to that, Abhishek?
I think more or less what he said is completing the entire thing. So only thing what I would like to add is the personalized care. When we talk about each patient is unique as for themselves also, for the doctors also. So they don't want a general opinion or a very random kind of answer for any of the question. It has to be very specific, and each personalization also very specific to how we give women care in the hospital, how we give the pediatric care in the hospital, and how can we take care of these kind of segment of patient who was having kidney disorders, kind of neurological problem. How can we differently treat them in the hospital, which is like a support system for the hospital instead of just becoming a general hospital, which everybody, because everybody has a different problem when they come to the hospital, right? So some part of the patients are celebrating like a birth is happening, somewhere the cancer has been detected, somewhere the old age patient going for a knee replacement. So different kind of patient emotion is happening day to day. So what we as an organization trying to do is these kind of patients, if we can separate, or we can keep them in a separated segment of care, where celebration can happen in one side, kind of trauma and things can be taken care in one side. In an entire treatment process, how can we personalize for their improvement of the care in terms of kind of even the customer care support team, even the nursing care, how we can make it very personal to each of the patient care. That is something which we can look at as an industry.
Okay. Sticking with you, Abhishek, there was a point that you mentioned earlier, and we will sort of go into details on that. You talked about how the situation and was different in different regions, the intake of patients, of course, in India being the most populous country in the world now. Yeah, how would you say marketing changes based on the region? How different is it for, let's say, an underdeveloped nation to a developed nation to a developing nation?
Yeah, so see, this the marketing strategy and the healthcare service providing, the way that we give service and things like that is entirely different from when you compare the large geography like US, UK, and Middle East and all. It's completely different. I think if I start discussing on it, it will go on for more than an hour. But the thing is, if you look at the India as a profile itself, North India, South India, and especially Tier 1 cities, Tier 2 cities. So everybody has a different dynamics of business. For example, cities like Bombay, Bangalore, Delhi, Gurgaon, and all these places are highly penetrated by insurance. So the insurance and the corporate business plays a major role in these kind of cities, and insurance makes their own terms and condition, because they are stronger in this market, where the corporate insurance and the retail insurance, the penetration is very high. So most of the cities like this, we have to sometimes go by what they put the terms. That's how these GIPSA, PPN, and all those things coming to the picture, and controlling the cost, controlling how the treatment needs to be begun, which kind of category of patient needs to be treated for how many days. These terms are set by insurance these days, for especially these kind of cities. And overall, what I would say is, and in terms of marketing communication also, if you look at it, some cities are very digital friendly. Some cities might be, especially Tier 2, Tier 3 cities, and all, still they are in these the local newspapers, local TV channels. The communication happens in even in the flyers in some of the cities. So it's completely different dynamics in all the kind of regions. So what is my suggestion is that when we are getting into a market, whether it is a new market or old market, we have to know what is the uniqueness of the particular audience, whether it is north or south, or west or east. The uniqueness of that market has to be completely understood when we are starting a business campaign or marketing campaign. And definitely the we need to go by the experts of the local market, basically the physicians who's practicing there for ages, and kind of some kind of influences which is there in that market. how are they advising in terms of how their marketing campaigns are working, what is working for them, what is not working for them, and the each and every campaigns what we are planning, or how we are planning and things like that. It has to have some kind of difference in terms of campaign, because especially when what happens is when the larger chains of hospitals like Apollo, Manipal, and things like, because it's a centralized pool of hospital which is network all through the country. So what happens is the marketing campaigns and all, which is usually designed by the central team, so which will not be able to connect to the local market, which is micro market, macro market, and things like that, because the corporate office might be situated in Bombay or Delhi or Chennai and things like that. What works there might not work in a city like Mysore, city like Gurgaon, and things like that. So each campaign which we do for specifically to a target audience, target geography, that has to be unique, and this has to be defined specifically for that target audience. And the content what we give, because these are the days which we are primarily focusing on content marketing and things like that. The content has to be driven and developed based on the local requirement. For example, the seasonal impact of the business, as Mr. Sarvan was mentioning. Each geography has a different season. Some place might be raining, some place might be having a lot of pollens, like city like Bangalore. So different season has different geographical requirement in terms of medical care itself. So this content, when we are creating for the various region, that has to be entirely different for each society. That has to be created very customized. And also what we can consider in terms of strategies, there are a lot of local bodies in each cities and each geography. It can be RWAs, it can be some associations, it can be Lions Club, Rotary Club. So different region has different strongholds in all these kind of local communities. So which has to be strongly connected with the healthcare business, because healthcare is a very emotional business. It's not like FMCG marketing. So it has to be the business has to be connected with the emotions of the community. So how do we connect with this emotion is basically with this local community, which is stronghold in each of the location. And also definitely this, which goes as a similar to entire thing, the regional performance review, which is based on the segment on which each region. When we are doing the business review for the particular hospital, it has to be regionally specific. Specific reviews needs to happen. It should not happen on a corporate level, which is random or which is uniform to the entire business of the country. So when it comes especially to a chain of hospital or a group of hospitals and things like that, is the few thoughts about the regional business strategy which I want to mention.
Sure, thank you. Now let me just shift gears, and I can see a lot of questions streaming in also. So, and if we don't take them up, the audience is going to get upset. So, in that regard, I think, Mr. Sarvanan, what are your thoughts on how digital transformation has changed the healthcare landscape? What sort of technological innovations, so to say, have helped drive things for the better, and what are some of the tools out there that you think have made a difference?
Okay, so digital transformation has played a huge impact in the healthcare scenario today. There are various modes by which a healthcare organizations will acquire patients. It's not that all patients need to come walking into the hospital to seek treatment. You have virtual clinics, you might have outreach clinics. Then patients can come through various sources. And with the advent of social media, digital platforms like Google, and you have aggregators who also kind of help in patient acquisition. Digital transformation is the key in today's healthcare business. Having said that, when you get patients from various sources, how do you kind of track the patient from inception, from the source? It could be a patient has inquired about you through your website or through your chatbot, or maybe you have advertised in Facebook. So somebody could have connected with you through Facebook, or you might have done search engine optimization through your website. You might have display ads in Google, so somebody could have connected with you on Google. So what was important is, how do you segregate the patient at source? How do you track the journey of the patient from the time you connect with them or they connect with you. How do you nurture these patients whom you potentially call as leads? And once you nurture this thing, how do you try to convert them and bring into your organization for some kind of a service delivery? It could be an outpatient consultation, it could be a diagnostic service, it could be a lab test, it could be a surgery, it could be anything. So there are multiple touch points that are there, which today need to be aggregated, needs to be tracked, needs to be monitored. So to that extent, I think organizations are investing in, say, CRM platforms. Organizations are investing in cloud telephony services. And the critical aspect between all these technological tools is how do you integrate and ensure that there's a seamless flow of data across platforms. It could be a CRM platform where you get the patient lead. It could be the cloud telephony platform where you connect with the patient. It could be your hospital information system where the patient data, the demographic data, the history, the medical history of the patient lies. How do you transfer data from one source to another? And how do you track the journey of the patient? Because we spoke initially today, the expectations from each and every patient is, apart from the clinical aspect, which it is given, is the non-clinical aspect in terms of their experience, in terms of the seamless integration of services and the delivery of care. So when you're able to connect all the touch points and ensure that the care delivery is optimized to the advantage of the patient based on conditions, based on symptoms, I think it is well received. And today, I think many organizations, be it in tier one cities or smaller cities, are investing on the digital transformation tools, trying to integrate, trying to kind of look at various touch points to see how you could kind of leverage each touch point. Because every patient touch point or every source is an opportunity for business. It's an opportunity to engage with the patient. And if you're able to connect with the patient, then the next aspect is to see how do you uh, keep that conversation going, and how do you see that you're trying to bring in the patient, because the competition is also pretty intense. So when you have a heavy competition and when you have people from all walks of life, from different geographies, within and across the country, how do you leverage that? How do you kind of ensure that you build trust, you build credibility with the patient, and pitch in your services, pitch in your service offerings, and get them to your organization. If you are operating in multiple cities, to any of those branches that you have, and you deliver the service. Maybe the patient is sitting somewhere way up, let's say in northeast geography, maybe in a Guwahati or a Tripura. But then maybe he's looking at a service somewhere in the west or maybe in somewhere in the south. How do you connect with the patient? How do you ensure that the patient comes to you? How do you ensure that you deliver care which is of global standards at the same time, which is competitively priced, ensuring that there is no compromise on the clinical outcomes, and there is no equally there's no compromise on the patient satisfaction indices. Today, apart from the digital transformation, I think organizations are also looking at measuring the net promoter score or the patient satisfaction levels. All are important. It's not that you focus more on experience and neglect the care. Without the care, the other things will not stand. But if the care is there, how do we ensure that we also are very high as far as the patient experience and the patient journey is concerned? And that's how the trust gets built up, and that's how the patient selects from the available options in terms of where to go, when to go, and whom to consult.
Okay. Now, definitely, we are here to answer all your questions. So I'll start with Dipali's question. Mrs. Sarvan and Abhishek, feel free to look at the questions as well. It'll be on the chat column for you, but I'll read them out anyway. So Dipali's question is, hi, how to define the success of a hospital? Is it repeat visits? Is it success rate of cure, etc.? What are your thoughts on that? I'll probably let Mr. Sarvanan go first, and then Abhishek, you can add to it.
As I said earlier, I think what is fundamental in healthcare business is building trust, is building credibility. If you have these two factors which are established, then you have a healthy relationship between the patient and the hospital or the consultant. One of the ways to measure the success of a hospital is to ensure to see whether you're able to build a loyal customer base. Today, the patient might come to you with a cough and a cold, but tomorrow he or she might come with a different problem. So if you have established your trust, if you have established credibility in your services, if you are able to build a repeat visit among the patient community, that's one measure of success of the organization. The other ways of measuring the success of an organization, obviously in terms of the treatment outcomes and the quality indicators, but also in terms of how the patient feels when they step into any organization or any hospital, from the time of entry to the time of exit. Are they treated with respect? Are they taken care of? Are they noticed? And are they is their time valued? Because just a simple example is, let's say you give an appointment to somebody at 11:30, patient comes at say 11:15, and you make them wait for half an hour, 1 hour. So obviously all the clinical work that is done to the best of the ability goes in vain just because the patient is made to wait. So even these small factors needs to be noticed, and when there is a seamless flow of the whole journey of the patient with best clinical outcomes, I think you can clearly define that an organization is successful.
Thank you. Abhishek?
So I think Mr. Sharon has covered most of it. I would just like to summarize on nothing more than a summarizing of the entire thing. So basically, the thing is, if you have to pick one parameter or one metrics of success of a hospital, I would not say any of these things. Actually, it will be a combination of everything. The success of the hospital, the revisit patients is important. The success rate, unless you get the success rate of the treatment, there is no patient going to revisit. So basically, it's an overall comprehensive development of the entire thing. Because one example, what I remember is few years back, NHS in the UK, when they wanted to incentivize and they wanted to see how do you measure the success of the doctor, how do you measure the success of the hospital. They wanted to come with some metrics. So then they thought they will go by the success rate of the patients, how many patients they are treated, and what is the kind of success ratio they are giving. Then what happened is none of the doctor wanted to treat extremely sick patients, because the moment you get into extremely sick patient, the chances of getting success is very less. So then doctors slowly moving out of taking criticality, and they try to do all the minor kind of treatment so that their success rate will go up. So if you look at the revisit rate, how does sometimes what happens is revisit happens just because the first time the patient visited, the patient is not cured itself. So that is the reason patient revisit. So these are all very what to say, very we cannot completely predict what is actually working, what is not actually working for it. Each specialty has a different story. Each disease has a different story. Each patient has a different story. So overall, if you look at it, if you have to consider success of a hospital, there are even though we have the market standard of each parameter, what should be the revisit percentage, what should be the percentage of new patient you should have in the hospital, what should be the mortality rate, what should be the infection control rate. These things are parameters are there as a standard in the market. But as you look at the success of a hospital as a whole, we need to focus on the entire thing, right from their NPS score, what is the Google rating, what is the kind of first point experience what the patient is having, what is the discharge time, what is the admission TAT. So the entire thing, comprehensive thing, has to be developed for the success of the hospital.
Okay.
And definitely, revenue is a major driver of the entire thing, which goes without saying. Unless you achieve your targets and the revenue, all other parameter, whatever you're achieving, it will not be appreciated. That is a fact.
Okay. Before I move on to the next question, I think Kartika has set up a bunch of polls. This is a message for the audience, so please do interact with those. I'll move to Ashwini's question. She says, "Hi, what and how crucial is the role of B2B healthcare partners if we speak about hospitals, online platforms, marketplaces, and laboratories?" Who would like to take this one?
Let me take this question. I think the success of any organization in the healthcare space is determined by the kind of partnerships that you have with many B2B providers. Because today we are not defined by geography. You might be operating in one city, but the care that you're providing could be across cities, could be across geographies, both nationally and internationally. And for you to kind of reach out to the patient population in these geographies, sometimes you might not have the physical bandwidth. This is where the B2B partnerships become very, very crucial and critical to drive business. So, as we said, that we can look at multiple tools of acquiring patients, and it's physically not possible for any organization to ensure that they put in all the resources to acquire the patients. They have to depend on partners and collaborators who could help them to kind of lead you to the patient in various geographies. So once you have connect with those patients, you work together as a collaborating team to kind of bring the patient in and offer whatever service that is required for the particular patient. Similarly, we cannot be dependent on only treating the patient. You need to look at all sources of revenue. Like a hospital is like a strategic business unit, wherein you have multiple departments. You might have lab where, for example, the laboratory department could cater to many diagnostic centers around the city. So you could be an aggregator for many of the local labs. Similarly, for the diagnostics, you could be an aggregator for the smaller diagnostic chains. So you need to look at every department, every opportunity that you have to connect with the online providers or B2B collaborators to see how you could partner with them and how you could leverage and offer your expertise so that you're able to cater to the needs of some population who you may not be able to directly access.
Okay, I'll move on to Satya's question. Abhishek, would you like to add, or would I just move on?
See, I think this question, see, when you say B2B partnership, B2B is a very general terminology which is used in the business. But I think what Ashwini is trying to ask is more about online platform like Pristin, M-Fine, and things like that. I mean, if I'm correct. See, these kind of aggregator, as Mr. Shravan said, these are a very important factor in your business growth. At the same time, when you are growing and developing your brand towards a vision of the founder or whoever, if you are going towards the vision, when you are getting associated with a B2B partner, we need to look at what is the intention. You need to look at what is their business goals, and what is the kind of motive which is driving this business which we are getting associated. Because if you are following the news in the healthcare, these kind of platform like Pristine, I'm Fine, and even 1mg was getting into this, the daycare surgery, and the kind of promoting for the surgeries, the one day surgery kind of things. They were in a large promotion, and it was being pulled down by many of the NGOs and the editorial things and all, because sometimes these kind of platform, what they do is they misguide patients. They may push too much for the surgeries. Actually, surgery might not be required. They will, because they have their own target. They want to achieve the target by achieving more surgeries and things like that. This can actually backfire the organization. So when we are looking at a B2B association with any organization, any business model, we need to understand how the credible they are, and what is the kind of intention behind all this business, and what is the kind of long-term business plan these people have. Because otherwise, if you get into association with some kind of brands like this, it can actually downgrade your brand itself, because for a short term you might be able to drive the revenue, but it might impact badly also in a longer run. So that is something which we have analyzed and understood about some of the business. I'm not saying all the B2B models are bad or good. So we need to be mindful of what kind of business model you are getting into when you are getting into business to business model.
Okay. I am moving to Satya's question, and I'll just put it up on screen. So, what are some of the best tools for medical health record which are friendly for, I think, the Indian customer? I'll just also just read out what he had put on chat. So, yeah, what are some of the best tools for medical health record in a country like ours, where every day about, let's say, in 2 hours OPD, approximately 30 patients are visiting? So, any suggestions on the tools there?
There are multiple tools as far as medical health records are concerned. I think many organizations have kind of moved to an electronic health record system, both for OPEMR as well as IPMR. I think depending on the organization size and depending on the patient load that they have, they can choose multiple hospital information systems. I think what would be critical is to choose a health information system, I mean, a hospital information system, which is also having a electronic medical record, because there are many HISs which do not have an electronic EMR. Because having electronic EMR, which is HIPAA compliant, where with proper the security layers as well as the data captured as per the ICD-10 coding, I think will help in portability of data and also in terms of better care. So depending on what kind of organization size that Satya is talking about, I mean, there are multiple providers in the market who have integrated, I mean, electronic health records. In case his organization does not have a HIS which has electronic health records, I think there are standalone providers which can provide medical health records alone, which can be possibly integrated with the HIS as well.
So if I have to name few of it, as Mr. Savan said, this again completely depending upon the business, kind of business volume, kind of business revenue your hospitals will have, because the affordability also makes a major role in this. So if I have to name a few, the leader in the entire world is the company called Cerner, and the second player is called Tracker. And then Wipro makes, Infosys makes. So basically, this hospital management system or a EMR is primarily is fully customized. So you need to tell them your requirement. You need to explain them what kind of understanding you're looking about, what kind of data you want, what kind of what up to what level you want to go electronic. Based on this is completely customized. So if you're a larger hospital where you can completely drive 100% paperless business like our model, where right from the appointment, prescriptions, your discharge summary, your all your consents, everything can be paperless. So if you have an atmosphere where doctors can cooperate with this, your customer care team can cooperate with the nurses, can cooperate with this, there are tools which you can take completely 100% without paper. You can drive a hospital business. So up to what extent you want to take your organization in electronic medical system, that is something which we need to consider, and we need to go by what kind of budget we can spend, because Cerner and Tracker almost charges almost a crore per hospital. Per hospital, they charge 1 crore per year. That is the kind of charges they make, and this is an annual subscription fees. And over and above, they charge for development, customer customization. So depending upon how much you can pay for it and how much is your requirement, based on that. And as Mr. Sarana said, it's different level. So you can either only look for prescription, or you can look for the entire system, even right from procurement, supply chain management, your vendor management, your payout system. Everything can be in one software. So there are multiple tools available depending upon what kind of investment you want to do for this. But overall, I feel over a period of time, we need to completely go paperless, which will help the patient, because nowadays nobody wants to carry their file to a hospital. It is like just tell your mobile number, and when you go to a bank, you don't carry your passbook anymore. So it is like that now. A patient expect just with your mobile number, you should have all your information with the click of a button. So that is a kind of expectation which has been coming up in the industry. I think we all need to move towards that direction.
If I might just add, Shibani, to what Abhishek said, the HIS softwares like Cerner and Tracker are all suited very well for the Western population. Adapting it and customizing to the Indian requirement would be of great challenge. That is point one. The second thing, the cost would be prohibitively high when you depend on Western softwares. Uh, as Abhishek pointed out, the subscription fees per annum itself will be exorbitantly high, and many organizations may not be able to afford it. Even if you look at the large chain hospitals like Apollo Group or Manipal or Fortis Group, they all depend on not Western softwares, but softwares which have been developed in India based on their specific requirements. So depending on what kind of requirements that you are envisaging, I think you can look at multiple softwares which could suit your specific needs and requirements. I mean, that's a way to look at it.
Sure, thank you. I will probably ask one of the last questions because I do want to get your closing thoughts before we wrap up the session. So, Harsh, I'll take your question. How can we effectively promote the adoption of new clinical research technologies and practice within the healthcare industry?
See if can I?
Please, please do.
Yeah.
Yeah.
So, see, if you look at large healthcare organizations, apart from managing patients day in and day out, it's also important for them to invest in clinical research and partner in all kinds of either post-marketing surveillance studies or randomized and phase two, phase three clinical trials. So it goes hand in hand, and you need an ethics committee which kind of sets up processes. You need to invest on clinical research. You need a separate department which coordinates with the clinical team. See, operations, clinical research, everything has to work hand in hand seamlessly. You might, because depending on your organization size and depending on the clinical programs that you run, you would have a huge population of patients with various disorders. And this is where clinical research and trials and things like that becomes very important, so that the data, you would have the patient population, you would have some of them enrolled on your say registries and clinical trials, which could be useful data points for one is for academic publication, but also to a kind of fine tuning and strengthening your own processes.
Okay. Abhishek, I'll probably let you answer the last question. So this is, he says, what you suggest or think is the most proven strategic ways to market your healthcare services in terms of technology, services, and environment to the public or patients in the midst of competition?
Um, can you come again the question? I didn't understand the entire question. Can you come again?
What do you suggest or think is the most proven strategic way to market your healthcare services of in terms of technology? So I think essentially what he means is, what are the marketing channels, if I'm not wrong, what are the marketing channels that you've seen work traditionally that have worked?
See, in terms of marketing strategy of a hospital, what I believe and what I've learned over the period of time is we should not look at too much of innovation in this marketing, because this is an evolved industry, and we need to, because people have tried enough of a different strategy, different kind of business model and things like that. But according to me, it has to be very simple. There are three, four marketing channels which is having for any hospital, which is your referral marketing, which is your corporate marketing, which is your digital marketing, which is your international marketing, and when it comes to branding, PR, and communication. These are the basic channel of marketing for any hospital. So this is not something new or old. This is the basic things. So what I understand is what is successful is the same thing what everyone are doing. That is the right thing to do, because there is nothing new to do in this industry. But whatever we are doing, we have to do it perfectly. So how can we improve all these things which I mentioned? If you're getting into the referral business, how effectively, how efficiently we can do this, which is better than your competition. Referral marketing, how differently we can we do it? There is no other way of doing referral business. There is only one way. You have to build your relationship with your referral doctor. That is the only way. But how better you can do, how differently you can communicate with them, how can you present your team in a better way compared to the market, compared to the competition. That is how it works. So all these basic things, whether it is corporate, whether it is international business, whether it is PR, communication, digital marketing, and all these things, how can we improve day by day? That's what we need to look at. And few advancement in terms of the digital marketing, which we are seeing off late. Very basic thing, how do we do search engine optimization, how do we do the social media campaign, and as I initially mentioned, the patients are also looking at information about the hospital, about the doctors and things like that. This has to be more accessible. This has to be more clear to the patient in terms of what kind of technology, what kind of doctors, what kind of caliber and things like that. And reaching out to the audience, which audience you want to target, what kind of patient base you want, what is the kind of target group you are looking at, that has to be specifically targeted. Because if you look at now, when we are looking at the target based marketing campaign, this is something which is evolved by with the business of M-Fine, Practo, and Pristine and all. With this, they are doing wonderfully. If you look at this Pristine, M-Fine, and Practo business, if you look at it, they don't have any infrastructure. They don't have any investment of capital investment of buying buildings, putting infrastructure and all. They don't have all this. Their complete businesses running on this digital platforms. So how they have done things are in terms of digital marketing, they are actually looking at each category, each geography. They have gone beyond, because when we started our digital marketing, we were looking at what is the age geography, what is the kind of geography we want to target, what is the kind of male to female ratio. These were the strategy. Now they are getting into the which when all the industries adapting into it now. Each geography, what kind of diseases are common, what kind of patient is coming for what treatment. In micro geography, like 5 kilometer radius, how many cardiac surgeries are happening, how many dental cares are requirement, how many cataract surgeries are happening in 5 kilometer radius. That's the extent of digital marketing happening in this generation. So at that level, I don't think even any hospital can get into it, because they have a digital marketing team of around 3,000 people on the floor. So that's a different level of digital marketing altogether. So I mean, there are a lot of evolvement which is happening. So as a hospital marketing head, or I mean business strategist, we need to look at each of these parameter. How can we do more efficiently? And especially we need to look at how to create awareness. We should not look at hospital businesses just generating leads, generating revenue. The public needs information, because now all informations are available just on the click of the button. But your brand should be a brand where create awareness. When that information comes from your brand, from your hospital, some information comes, once some video comes, some write-up comes, some article comes, this should be reliable. So this, people should look for your information. For example, now COVID vaccination side effects, people are talking about it. When your brand talks about it, when your brand writes an article about it, based on the requirement of the market, that has to be reliable. So that's the kind of thing when we are looking at how we make the awareness and kind of impact in the community. And also what we can look at is all the marketing decisions, all the strategy, all kind of planning, all kind of yearly planning, quarterly planning, and things like that. This has to be purely data driven. We need to invest a lot in terms of data. When I say, it's not only the sales and geography and things like that. The data, how I made an example of how Preston is working on the data of each patient profile and things like that. So it has we need to move into a complete data driven marketing program for each of the geography, each of the hospital, each of the centers. So that is something as a training and developing of our team. How do we do this data driven marketing? This is something which getting evolved from Harvard Business School and things like that. Data driven marketing for hospitals and things like that. These are some of the advancement what we can do. And also definitely we can and the basic thing, pay per click, how we can improve, how can we improve our search engine optimization, how effectively we can do the videos, and social media marketing when we are doing. See, even if you look at Cleveland and Mayo and all those things, they are making their awareness and presence through this basic Facebook and Instagram post and all what they're giving. So how effectively we can do, how effectively we can use the mobile marketing, and how effectively we can create content based on the requirement of the market and things like that. So basically what I'm trying to say is, there is no new method, there is no new thing which we have to do. Whatever we are doing, the basic things which has to be evolved every day in our data, in our kind of intelligence, in terms of strategizing. We need to try to improve the the basic thing what we are doing on a day-to-day basis.
So, Shivani, just to add to what Abhishek said, I think the person who asked this question wanted to understand how successful your marketing strategy could be. I think for a healthcare organization, either you should have complex clinical programs, or you should have clinical level differentiation, or the most important thing is service level differentiation, or the kind of digital tools that you're using to communicate the strengths and the opportunities that you are offering to various patients across geographies. I think if you focus on these aspects like the complexity of programs, clinical differentiation, service level differentiation, and digital transformation tools, that would probably define the success of your marketing strategy in a crowded marketplace.
Awesome. Thank you. I think that was great advice from both of you for our Lead Square marketing team as well. We'll definitely try a thing or two from that. With that, I want to conclude the session. I will probably steal the line Mr. Sarvanan you had shared in our earlier discussion of think global and deliver local. So, with that in mind, Mr. Sarvanan, what would be your advice to fellow healthcare marketers out there? How should they approach the way forward?
So the message that I want to leave with the audience is, as far as the healthcare scenario in India is concerned, our clinical outcomes are almost on global standards. I mean, we are second to none as far as the clinical acumen is concerned. We have some of the best hospitals, we have some of the best clinical services, we have some of the best services. I think if you compare ourselves with the Western world, where we probably lack is in the to the extent of which digital transformation has kind of taken place in the respective organization. The only way forward is to kind of evolve the healthcare scenario using digital transformation, kind of using IoT devices, using robotic process automation tools, structuring your data, ensuring data portability so that the care delivery could be seamless and could be of international standards. And the significant advantage that India offers over the Western world is the competitive, the cost. So in terms of the cost, I think I mean, that's where, if you look at medical tourism, though we are only tapping just 1% of the total market size, there's a huge opportunity. People now are looking at India because of not just the clinical outcomes, not just the cost, but in terms of technology. As an industry, as large healthcare providers, we are on the right track. The my only concern, if I might say, is the many organizations are still thinking traditionally. They are probably not investing, or the pace of digital transformation has to be much more enhanced. That would be my only piece of advice or a take home for the audience.
Thank you so much, Mr. Sarvanan. Abhishek, we can't wrap the session without comments from you.
Yeah, overall, what I would like to conclude is we, as a healthcare marketers, we need to do our basics correct. And at the end of the day, what matters is the patient who is walking into a hospital has to go out with a good health. So for that, all these support system, that marketing, finance, and operations, and all these things play a major role. And going forward, I think as a Indian healthcare, what we need to, as an organization's point of view, we need to learn, we need to put our effort and energy and believe that this digital transformation is an important thing which is going to happen in the industry. For that, we need to invest money, we need to spend time, we need to put a lot of effort into it. It doesn't happen just by 1 or 2%. Overall industry, because the kind of advancement which is happening in the healthcare, in terms of oncology treatment, in terms of robotic surgeries, in terms of AI, which is coming into investigation, diagnostics, CT scan, MRI, all these things are coming up very rapidly, and along with the electronic medical records, like a brand like us, we are ready to invest 70, 80 crores on track care. I mean, this is something which is not possible without a support from a senior leadership who's actually believing in this can work in countries like India, where we have competition, where we have Ayushman Bharat coming into, CGHS rates coming into. There should be some vision towards developing these kind of advancement which is happening worldwide. As Mr. Sharman said, we have talent extremely. We are filled with extreme talents, especially doctors, in terms of nurses, in terms of the kind of marketing guys we have in the country. We don't find it anywhere else in the world. So we have talents everywhere. We have good people who are thinking beyond the limits. So only thing is we need to move towards the advancement of the healthcare in terms of technology and this kind, and also data driven, something which we need to how we can improve all this mass data which we have. Data, when I say what kind of patient profile, what kind of how, treatment are we giving for oncology patient, what kind of treatment are we giving for cardiac patient, diabetic patient, these kind of data what we have as in India, nowhere else they will have this kind of large data. And these data can be used for many tools and many development of medicine, development of clinical research, treatment, everything can be used. Otherwise, if you don't use this data, it will just lie as a server load. We need to use this data for further improvement of the healthcare community. That is something which we need to look forward. Yeah, I mean, we can go on discussing like this. So I think I will put a full stop and handing over to you. Thank you very much.
Thank you. I've had a lovely time having this discussion with both of you, and I am sure the audience did too, because I still see questions pouring in. So, because of that, I took the liberty of sharing your LinkedIn profiles there so the audience can directly reach out to you if they have further questions. With that, I'll hand it over to Kartika to end the session.
Thank you so much once again to all our speakers. Thank you so much, Mr. Saravanan and Mr. Abhishek and Shibani, of course. It was a very informative session. I mean, it definitely helped me realize how important the role of technology is and how much digital transformation is helping the healthcare industry, and of course digital adoption, how important it is. So just like me, I know that the audience have gotten a lot of takeaways from this as well. About the questions that have poured into us, if we have any more questions, please do reach out to us over email. We'll try our best to answer them for you. And of course, just like Shibani mentioned, our LinkedIn's are also available. Once more, I would take the time to thank all our speakers for joining in on, I'm sure, which is a very busy day for all of you. Thank you so much, and I wish everyone the best of luck and have a nice day. Thank you so much.
Thank you so much,
Thank
everyone.
you. Thank
It
you,
was
everybody.
bye. Thank you.
Thank you.
Thank you. Have a good day.